Welcome back to A New Me. We are here with one of this area's top plastic surgeons, Dr. David Kung. Welcome, Dr. Kung.
Thank you very much. Always great to be here.
Oh, it's our pleasure to have you back with us again.
Thank you.
Let me begin by asking you, what is the newest advancement in Scarless breast augmentation?
Well, breast augmentation surgery has been around a long time. The procedures that are currently prevalent for augmenting the breast all involve scars that are very visible once a person removes their clothes. The newest in augmentation involves an access portal that's completely out of the line of sight, and that's the exciting news.
So there's virtually no scarring, I take it, then?
No scar that can be visibly perceived.
And what does this entail, Dr. Kung?
Well, the traditional approaches to augmentation surgery involves surgery either around the nipple, underneath the breast, or from the underarm area. And those areas all can be visualized if a person is moving just so. Scarless breast augmentation involves an access through the umbilicus, that is, through the belly button, where no scar would be seen. And that's the new approach for augmentation.
And how invasive is this procedure?
Well, you do have to tunnel from the belly button to the breast area or the implant site. But it's a small, soft tissue tunnel that doesn't hurt very much afterwards at all. And basically what's involved is through an endoscopic approach, we use a small little scope from the belly button, dissecting up to the breast recipient site and dissecting it with special custom-made instruments. We can put implants above the muscle and below the muscle, and we can actually even remove implants and even change the shape or the position of implants, all from that same access.
Very interesting.
Yeah.
And who's a good candidate?
Well, the ideal candidate is a person who doesn't have a long distance to travel from the belly button to the breast. And a good candidate would also be someone who doesn't have a lot of tissue in the way. So preferably somebody who doesn't have a lot of excess sagging skin or a lot of fat in the area. Another person who would be very, very good for this type of technique is if they've never had any surgery in their abdomen before. Basically, short of those, what we'd say contraindications, anybody would be an excellent candidate.
And what kind of results would we expect from this?
Oh, you would expect very, very natural appearing breasts without any sign of any surgery. You'd look like you were born with those breasts, because when a person...
That's always the key, the natural look, right?
Oh, absolutely. When somebody looks at you, they won't be able to tell anything was done because there are no scars anyplace. And my patients have loved it.
I believe you have some before and after pictures you'd like to show us?
Sure.
Let's take a look.
Okay. Okay, in these photographs, we see a lovely young lady here who is an ideal candidate for scarless breast augmentation. She doesn't have a lot of droopy skin, doesn't have a lot of sag, and she has no scars on her body at all, and that's the way we want to keep it. On the left is her preoperative frontal view. This is the state that she was in before her surgery. On the right is her postoperative view after she's had her augmentation, and as you can see, it appears very, very natural with no scars at all. Not that the majority of our patients would be running around without clothes on, but it's always nice to know that there are no scars that are visible at all. In this next set of two, this is what we call the three-quarter view. Again, the left side shows her state before her surgery. The right side shows her state after she's had scarless breast augmentation. Again, you can notice for yourself the nice change in the shape of the breast, and the size of the breast, and in the volume of the breast. This next series of two, also again on the left, her preoperative lateral view. On the right, her postoperative lateral view, and you can see a very, very nice natural silhouette that can be obtained with a nice slope and a very, very nice curvature on the inferior pole of the breast. The same thing can be seen in these last two sets of photographs. Again, on the left before surgery, on the right after surgery. This is her left lateral view. And again, a very, very nice and natural shape of the breast with no scars, and that's the key.
Very impressive, Dr. Kung.
I think so, and our patients have been very, very appreciative. Nobody wants to have an operated look. And
That's right.
to have no scars is really, really the best of both worlds.
And we certainly saw the natural look that you had mentioned a little bit earlier in those pictures.
Right. You can get a very, very natural result, and with no markings to show for it.
Now, how long does this procedure typically take?
Well, believe it or not, this procedure, technically it's called the endoscopic augmentation mammoplasty, or the Scarless transumbilical augmentation mammoplasty, takes less time than a traditional open approach. And the reason is we do less cutting, there's less tissue dissection, and as a result, maybe an hour to an hour and a half, start to finish, a person would be completed. It's not out of the question that we can be finished under an hour, and sometimes 45 minutes.
So there's less involved, hence the shorter time, but at the same time, it's more precise, and you can get the exact look that one is looking for to achieve.
Absolutely. You can get the same result that we had been getting with the open approach, which still is a good procedure, with less time, with less dissection, less cutting, and faster recovery. That's actually another nice thing about this procedure. No scars is one thing, but then if you can recover faster and be back to work, within a couple of days, patients would jump at that.
And how safe is this technique?
Very, very safe. This technique, even though it's relatively new, has been utilized, probably for the last 5 or 10 years, all around the country and all around the world. The complications actually associated with this procedure are much less than they would be for an open procedure, believe it or not. Again, because you're not cutting. So there's less chance for damaging nerves, for damaging blood vessels, for damaging tissue in the area.
Now, we've only got a few moments left, and I have to ask you this. Is there anything out there that you can help us with and enlighten us with, certainly as far as what we should be careful of and wary of when it comes to looking into getting this procedure done?
Scarless breast augmentation surgery is still something that requires specialized, number one, instruction and specialized instrumentation. So I would caution someone when they went to seek this, or when they go to seek this kind of procedure, to make sure that the person has experience in doing this type of procedure, because it is a little bit different than the traditional augmentation that we do, and that they have custom-made instrumentation that allow them to do this procedure in the safest possible way.
Very well said. That was very informative. I want to thank you, Dr. Kung, for being a guest today on A New Me.
Always a pleasure.